What are the possible lesions of a head trauma? It varies a lot according to the intensity and the point of impact, but we can classify 6 direct consequences of a head trauma. The first one is concussion. It's made by the movement of the brain inside the skull. It can cause brain tissue damage and edema, and it can lead to coma. In slight cases, it can just regress in few hours, or in the worst cases, it can lead to a vegetative state. The second one is brain contusion. It's called crushing the brain lesions. It combines hemorrhagic necrosis and edema. It's more commonly in frontal and temporal lobes, so it affects attention, emotions, and memory. The signs and symptoms are the loss of consciousness, dizziness, drowsiness, confusion, headache, nausea, and weakness. If the brain contusion is minor, it will heal on its own. But if it's swelling or form blood clot, a surgery may be required. The third one is extradural hematoma. It's the concentration of blood between the skull and the outermost membrane layer of the brain, called the dura mater. It's very often temporoparietal because it's a zone of weakness, and if the collection of blood expands, it will increase the intracranial pressure, which is not very good at all. We need to be very careful about this patient. The signs and symptoms are the same as in the brain contusion, but you can look for an enlarged pupil in one eye. In infancy, we can look for this also because the dura mater is not firmly attached to the skull. We need to be very careful because they are lucid intervals. At the initial trauma, there is a brief loss of consciousness, but then there is a lucid period for a few and several hours where there is no cognitive impairment because the blood is accumulated, but then it will lead to a severe cognitive impairment or even coma. It's created in 6 hours. A clinical surveillance in hospital is essential. It's a neurosurgical emergency. The evacuation of the hematoma to lower intracranial pressure. Then the subdural hematoma. There is a rupture of the blood vessels between the brain, especially the arachnoid, and the dura mater. There are 3 categories of subdural hematoma, depending on how quickly the symptoms come. The acute one is when there are a severe head injury. The symptoms come immediately. This is the most dangerous because death can occur if it's not treated. Then you have the subacute and chronic subdural hematoma. It takes days or weeks before the symptoms appear. It bleeds much more slowly. The signs and symptoms are the same as in the brain contusion, but you can add seizures, impact on speech, vision, coordination, hearing, and lethargy, and personality changes. Then the intracerebral hematoma is any bleeding inside the structure of the brain. It can be intracerebral or intraventricular. It manifests with abnormalities in the neural exam focus and related to the area affected. And finally, the traumatic subarachnoid hemorrhage. It's a burst of blood inside the space. It is under the arachnoids. It's a clinical picture of meningitis without the fever. So the symptoms are stiff neck, explosive headaches, jet vomiting, photophobia, phonophobia, disturbed consciousness. You need to do a CT scan and a lumbar puncture to see if there's no blood in the cerebrospinal fluid.